Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today, my topic of discussion is lasers and their related eye injuries. Laser is defined as light amplification by stimulated emission of radiations. Nowadays, it is commonly used in commercial activities, medical purposes, even in entertainment industries, and it is also being utilized in the toys the children are playing with. Lasers can cause a lot of damage to eyes if inappropriately used. They may cause subclinical changes in the eyes, in the retina, or the damage may be so much that all layers of the retina are involved. The laser causing changes can be easily appreciated by OCT. They may cause internal retinal layer damage by causing vertical bands. They may damage ellipsoid zone, external limiting membrane, and even they can form the cavities in the retina. Retinal injuries by lasers have been classified into mild, moderate, and even severe changes. Mild changes are diffuse changes, which occur because of low intensity damage. Moderate changes are when the intensity is threatening the vision, and these may be more diffuse changes in the retina. While hyperreflective changes causes bands in internal retinal layers. So these things help us in making classification as well as deciding the prognosis. The damage by laser to the eye depends on so many factors. The type of the laser, the classification of the laser, the time duration of exposure, and the diameter of the laser beam, wavelength, power output. All these factors contribute to the final damage. Lasers may damage by thermal process. They may damage by photochemical or by ionizing process. In UK, lasers have been classified into 4 categories. Class 1. Class 1 category lasers cannot damage the eyes irrespective of duration and exposure time. They are of such low intensity. Class 2 lasers are also incapable of causing any damage because of the blink reflex, which is 0.25 seconds, and eversion of the eyes. But if prolonged exposure, they may cause some damage. Class 3 lasers. They can damage the retina under direct or specular vision. It is the class 3A lasers which are allowed in the United States of America by FDA to be used in entertainment industry. They are usually of 5 milliwatt power and the wavelength is 400 to 710 nanometers. Class 4 are the most dangerous. They can cause fire when come in contact with any material which is capable of producing fumes on heating. So up till 3A, things are relatively safe. But after 3A category, the lasers become very risky and can cause potential damage to the eyes. So this is the fundus photograph of a patient who presented to us with damage to his macula by blue light of the laser. you can see the full thickness over there, a macular hole, which has been caused by the lasers. This is the OCT end phase. Even on OCT end phase, you can see this hypofluorescent area which has been encircled in blue color. This is the damaged area because of the laser beam. There's another section of OCT. Here you can also see, which I have done black encircled area, showing as blue color in the center of the fovea, which shows the damaged area of the macula, right in the fovea. So if we talk about the prognosis of such patients, it is usually good. 11 and 13 months up till that time period has been seen where the patients have developed recovery. Many physicians have used steroids. They have also used lutein as an anti-inflammatory agent, but usually it has good prognosis. But if the lesion develops choroidal neovascular membrane, you have to apply the anti-VEGFs. So when we talk about these issues, it is very important to understand the safety protocols. The people who are handling these lasers, for example, any musical concerts, any shows, anywhere, they should be quite capable of handling these machines. Lasers are being used in the pointers for the presentations. So the protocols are very important because the prognosis and the depends upon the extent of the damage. If it is mild, as I mentioned, recovery can happen up to 1 year, more and less and like that. But if it is extensive damage, all layers have been damaged by the laser, the lesion is going to persist. So everything should be made clear to the people who are handling these lasers, and their safety protocols should be done. For example, in United States of America, up till 3A, you probably do not need any permission. But after 3A category, if you go towards 3B category lasers, you have to take special protocols, you have to take special permissions. So while handling with children, we should also be very careful. We should not give these laser pointers which used for the presentations like this to the children for playing purpose. This is not a toy. This is something very serious. And all the laser devices should have precisely written all the protocols, their classification, calibration, their safety protocols. These are very important because nowadays we are encountering a number of patients who by mistake or because of lack of knowledge or anything, they do not understand and they play with it like any other light beam and damage their eyes. I want to thank all of you for your attendance and your listening this presentation. Thank you.